Good afternoon, everyone. I'm Governor John Carney here again for Delaware's weekly press conference on our response to COVID-19. I'm joined, as I normally am, on this Tuesday briefing with Dr. Carol Rattay, the Director of the Division of Public Health. As always, thank you for the great work of your team, and AJ Shaw, the testing and vaccination key point person, our Director of the Delaware Emergency Management Agency. We also have Pam, our sign language expert for the deaf and hard of hearing. Thank you all for joining us today. We're going to give you an update as we normally do with the data dashboard in terms of the number of positive cases, the trend there. We're seeing some negative trends, unfortunately. The number of hospitalizations, which are flattening out a little bit, but continuing to increase. The number of tests, AJ, are holding a little bit strong now, a little bit up, a tick up this week at around 35,000 a week. And so that's a pretty good number given what we expected a year ago. Obviously, that enables us to track the presence of the virus in our community and make thoughtful decisions based on that science as to what to do with our restrictions. Wearing masks, we do continue to see pretty good compliance with mask wearing. I know folks are getting frustrated with that, and particularly as the weather gets warmer, and we've had some really delightful days recently. I notice on the roads as I travel up and down the state more frequently myself, more cars out there, more people getting outdoors. We have beautiful outdoor spaces in our state parks, local parks, recreational areas, forests and beaches, some of the best beaches in the country. Really good places to go now as the weather gets better to get some of that fresh air, kind of release some of the anxiety of being cooped up for a year, fighting back COVID-19. It is really important, though, that we lean in these next couple of weeks in particular as we move into late spring and the end of the spring into summer. We know and hope that things will get better as the warmer months come. We're making really good progress on vaccinating Delawareans, well over 600,000 vaccines administered so far. We'll show you those numbers in a minute. A significant percentage, over 80% of the most vulnerable population are senior citizens, those 65 and older that have been fully vaccinated or at least received one dose, and about 70%, over 70% fully vaccinated of that group, which was really good progress. Almost 50% of the rest of Delawareans, or total Delawareans, which have received at least one vaccine. That's really good news, and about 30%, over 30% that have been fully vaccinated. We got some maybe promising news on the J&J vaccine, which was one that was probably seeing the greatest demand for folks, being that it was just one dose, one shot and done. On our White House call this morning, the indication that maybe by the end of the week, the CDC will have its analysis done and we might be ready and back online there. That'll help us out in a big way, AJ, for the last couple of weeks of Dover Downs. We are running the full course of Dover Downs over the next 2 weeks, and it's been a real godsend, enabling us to get 10,000 or more doses over a weekend at Dover Downs. Most of the doses last weekend, all the doses I think at Dover Downs last weekend were second doses, so enabling all those folks to get fully vaccinated. A number of the doses that will be administered at Dover Downs this weekend, including my own second dose, will be second doses as well. Again, pushing that number up. So let's go right to the data dashboard and we'll get a little bit more specific about it. I mentioned the new positive cases going up, at a 7-day moving average of 370. We don't want to be headed in that direction. We were moving under 200 new positive cases on a day-to-day basis, 7-day moving average just a few weeks back. Over 5% positive now in the number of new cases to the tests that are being done. Again, over that 5% threshold that we try to be under. Hospitalizations ticking up a little bit, although fairly level over the last several weeks, which is a good thing. And fortunately, particularly with the number of seniors, the most vulnerable population vaccinated, The number of fatalities has continued to flatten out. You can see that on our website on the data dashboard if you want to see the graph. Say from February 1st until now, that increase has been very slight. Obviously, one death is a sad occurrence for those individual family members and neighbors that experience it. And so we want to eliminate deaths completely. But that indicator is flattened out. I mentioned the number of vaccines that have been administered, over 650,000, an incredible number. Kudos to so many of our volunteers, so many of our partners, the hospitals, the pharmacies, AJ and Division of Public Health, their teams at Dover Downs, Speedway, Curative, and Deltec campuses in the 3 counties. Our outreach, community outreach to the Latino and African-American communities up and down our state with Lisa and her team at the Division of Public Health. As I mentioned, fully vaccinated, now over 230,000 at 234,628, about 30% of those that are eligible to be vaccinated. And again, almost closing in on 50% of Delawareans 16 years and older, those who are eligible for a vaccine or for whom the vaccine is available, and 30% of all eligible Delawareans are fully vaccinated. So moving those numbers up, we'll continue to push the fully vaccinated number up this weekend as we do seconds there at Dover Downs. And again, with those individuals 85 or 65 and up, 85% with at least one dose, and 71% fully vaccinated. So we're making real progress. This is a way of showing it on a graph from December 15th when vaccines were first available. You can see we hit 100,000 in 44 days, tripled that 41 days later, and doubled that again 33 days. So we really have been accelerating, and it really has been at the rate that we've been provided. So we could have done more earlier if we had more vaccines from the federal government. We do get vaccines that go directly to pharmacies across the state, and they've been a tremendous partner. And that allocation has increased over the last couple months more than our state allocation, and they have been getting shots in people's arms as well, and we'll continue to rely on them. We are seeing a little bit of a softening of demand as we move through the wait lists and our registration list. You're still welcome to sign on to our wait list. It's the best way to get an appointment for one of the state vaccination clinics, and you can get registered with your local pharmacy on their pharmacy registration sites as well. Current hospitalizations, you can see the tick up here more recently. Back in April when we had the first surge, we went from 167 on April the 9th to just a couple weeks later to 337 in the hospital. So people that we know, they're in the hospital, they're COVID-19 positive. We can count them, the hospitals count them for us and then report. We hit a low in the latter part of August of 29, and then that started to tick up as we went through the fall. Students went back to college. We saw an uptick in positive cases, and that resulted in hospitalizations. So we hit November the 2nd, 107, and then that almost tripled in a month to December. Again, Thanksgiving, holidays, people getting together, a lot of exposure. We topped out at the peak there in January after the December holidays, another run up in cases and hospitalizations. We're making steady progress through February and early March, from 326 and February 1st down to under 100, and then gradually growing there to 163 as of yesterday, April the 19th. We want to flatten that out, and we need everybody's help to do that. Be conscious of avoiding gatherings, wear your mask when you're in public, don't mix households, just be conscious of your exposure to others who might be carrying the virus. And remember that you don't have to have symptoms to be carrying the virus. That's one of the things that sadly we've learned over the last years is you can be COVID-19 positive, test positive, be contagious to those around you, and you don't have any flu-like symptoms, which is normally the case. So be careful, be safe. Let's lean into this thing so we can get more fully reopened and get back to life more normal as we move into the summer and the really warmer months, outdoor months, where we can have outdoor dining and feel a lot safer. Next up is Dr. Rattay. Dr. Rattay, thank you for the work of your team, all the volunteers and others that have been really leaning into this now for over a year. We appreciate your great work.
Thank you so much, Governor. So I'm going to highlight a couple points today, some points of caution, but overall we've got some really good things going on. So we'll talk about that as well. So for areas of concern in our state, using the same methodology, so the same criteria that we've been using for several months now, we now have 26 zip codes that meet that criteria. So this is the third week in a row where we have seen an increase in the number of zip codes that meet the criteria. The areas are mostly in Newcastle and Kent County still, with a few in Sussex. And this is consistent with what we're seeing as far as our case rates in the state, where we have the highest number of cases in Newcastle, and Kent County is second for case rates, followed by Sussex County. Let's shift a little bit to talking about the variants. We've been talking about these for a few weeks now. And this is also an area that leads us to be cautious, like the rest of the nation, but especially in the Northeast, this part of the United States, we are seeing increases in COVID-19 variants. And this level of variance among our cases helps to explain our case numbers. And, it is a warning sign that we have more contagious strains of this virus circulating in our community right now. Of the variants of concern, the UK variant is now up to 95 cases found as of last week. And among the variants of interest that we've been tracking, we're up to 81 cases of the New York variant. Again, these two variants are more contagious than the variants or the what's called the wild type, the COVID-19 that we've been mostly dealing with over the last year. I do want to point out, as I did last week, that these numbers that we present here are just a snapshot of the variant level. I mean, it's really just a sampling of testing that's done in mostly all in our lab. What's really significant and helpful in looking at these numbers is to look at the percent of the samples tested that end up being positive for variants. And if you recall, not long ago, we were at around 8-9%, and last week around 26%. And now we're up to 52% of our specimen tested are testing positive for variant strains. So that just shows you that we are seeing more of these contagious variants in our community. So let's just kind of talk about a little bit what this means. I mean, overall, we are not where we were in the winter surge from the data that the governor was showing us. But we have seen another increase in our case rates, about 20% since the previous week. Right now, Delaware is the 5th highest state in the country for case rates after Michigan, Rhode Island, New Jersey, and Pennsylvania. These are all signs, even as we have vaccinated many people, that we can't get complacent. The virus is not yet slowing down. So, and the governor just mentioned this, but I'll reiterate because it's so important. Wearing a mask continues to be so important. So, in public, especially, wear a mask. stay distant from other people in public, avoid indoor gatherings, and getting vaccinated as soon as you can. This is so incredibly important. And now that vaccine is available for everyone 16 and up, the cases we're seeing right now, it's really an important reminder. Vaccination, the more people that take advantage of vaccination, the more we're going to be able to push that down. But additionally, as we've been talking about for over a year, testing, especially if you think you've been exposed or are in a job that exposes you, and also participating in contact tracing and isolation and quarantine, if appropriate, really remain foundation to our boxing this virus in. So speaking of vaccination, let's talk a little bit about J&J. Last week, we talked about the FDA and CDC jointly recommending a pause in the administration of the Johnson & Johnson vaccine after an issue was found involving blood clots in 6 women out of almost 7 million administered doses. And interestingly, some people have asked me if I was frustrated with this action due to the low number of incidents. It's only 6 cases, but my response has been that this action should really bolster the confidence of the American people in the vaccine safety processes, that these agencies would take a break from the millions of ongoing vaccinations with J&J to better understand and be transparent about this issue really shows just how seriously they take the safety of these vaccines. So the CDC's Advisory Committee on Immunization Practices, called ACIP, they met last week and they wanted more data. They wanted to, spend more time better understanding what we know here in the US, as well as what we know about the AstraZeneca vaccine, which is a similar vaccine type in Europe. And so they'll be meeting again on Friday. And should they recommend lifting the pause, people should feel confident about being vaccinated with the J&J vaccine based on, again, the low rate of incidence, and also based on the fact that the medical community has now certainly been made aware of the potential issue and how best to treat it. So should J&J vaccinations be recommended to resume, we are ready to restart. We have a little less than 5,000 J&J doses on hand, DPH does. And so we'll likely make those available at an event the weekend of May 1st. But also pharmacies in Delaware have J&J doses that they've been holding on to during this pause. So they'll likely be another source for the 1-dose vaccine once the pause is lifted. And finally, I just want to remind people about the COVID Alert app. With the warning signs about these more contagious variants and the case rates showing a slight increase, it's important to know when you've been exposed to someone who's positive for coronavirus, so you can be tested, and if necessary, so you can quarantine or isolate. And that's really the purpose of the COVID Alert app, which now has more than 111,000 downloads, or about 14% of Delaware's adult population has this app on their phones. As some may remember, or for those who aren't familiar, this is an app for your phone that will let you know if you've been in close contact with someone with the app on their phone who's tested positive for COVID. And it does this all anonymously. It doesn't track you or anyone else. The app uses Bluetooth. So you've been in close enough contact with someone who later tested positive and inputted their positive results into the app. And if you have been in close contact with them, it will alert you. But your identity won't be revealed, can't be revealed to anyone else. So this is a system that will work better the more people who download and activate it. And so we want to remind people and urge people, if you haven't downloaded this to your phone yet, this is a really good time to do so. And with that, I'm going to hand it back to you, Governor. Thank you.
Thank you very much, Dr. Rattay. Thanks for filling us in on that information. Some good news, hopefully by the end of the week with the a restart on the J&J vaccine. That would be a big one for us because it is one and done. You get somebody fully vaccinated with 1 dose. Very few cases have been identified per the White House report this morning, and a greater understanding of that. We'll see how that plays out at the end of the week. AJ, thanks for the work of your team, both on the testing side, which continues to be strong, a stronger week this last week than the week before. And vaccination clinics, and again, another strong week at Dover Downs with those second doses.
Yeah, no, thank you, sir. Definitely good news to see that our testing numbers go up a little bit last week. We knew that with people traveling around spring break time and the holidays that there could be that possibility. So we're excited that those numbers went up. And again, you could go to de.gov/get-tested to look at all the testing sites across the state. Again, we have not cut back any of the clinics where we're testing at. The hours may have switched a little bit to host vaccination as well, but Walgreens is still a good partner. We have the at-home process for those that could order from the website, and then we have the curative trailers that travel the state and are in all the different parts throughout Monday through Saturday. So can I go to the next slide, please? So yeah, we did see about 3,000 increase, which pretty strong, about 10%. It was pretty consistent across the state where we saw these numbers. And again, as Dr. Kay said, we've seen a higher percent positive, we've seen higher case numbers. So it's still important to make sure people are getting tested and knowing their status. So de.gov/get-tested has the most up-to-date information for those testing locations. Just a side note on that, the Abbott Buy Next Now kit, which is an antigen test, is getting shipped out to some retail pharmacies for sale, which is a instant antigen test you could do at home. So just shows you that the testing world has changed 180 degrees over the last 12 months, where we couldn't test enough to now where you could go into a pharmacy in the next few weeks. You can get a product that we've been using in the state since about November for some events, and be able to use it yourself to feel comfortable that you're not spreading COVID to family or friends. Next, we'll talk about our Dover event. So, back in February, we had this really two tasks. We knew we were going to have increased supply coming into the state very quickly, and we also had a lot of second doses that we had to make sure people got in a timely fashion. And we looked at options, whether it was the motor vehicle lanes, whether it's school parking lots, and we just came up with the thought of, hey, if we use something in Dover, it's the center of the state, just about an hour away from everywhere, and easy to get on and off from Route 1. And Dover International Speedway was, more than gracious to host us. And our time there is coming to an end, sunsetting, ironic picture that we have here. But we've hosted over 20 events, 70,000 vaccinations. And that doesn't even include the numbers when we kicked off with FEMA back in February. And this has really been about partnerships. The Speedway, DelDOT, the Medical Reserve Corps, FEMA, the Division of Public Health, and all Diane's team, and everybody else that's been out there through the windy and cold and rainy days when we started, through the warmer days we've had, where we've had to switch the heaters to air conditioning in some of the pharmacy tents to make sure we could keep the vaccine at the temperature it needs to be, to the 3 county paramedic agencies that have all sent individuals down tirelessly to assist with the vaccinations, St. Francis EMS, which has provided the ambulance on site, and others. I'm sure we're missing people on this list. And last but not least, the National Guard, that is anywhere from 80 to 100 individuals that work this event. And it's been a long road. We still have a long road ahead of us, but if you look where we are now compared to where we were just a few months ago, it's good news. 30% of the people fully vaccinated, and those numbers keep on increasing. So we're going to finish out Dover this week with really we're doing some outreach. We know college students in that age range, 20 or 18 to the mid 20s, is a very high risk population to spread COVID. So this morning, Dr. Tate's teams worked with the universities and colleges throughout the state to invite them to a university and college vaccination event this Saturday. So we are attempting to vaccinate 5,000 college students, which should be a huge undertaking. It will be a Moderna, so it will be a 2-dose clinic, which would one day now. The second date will be held at the Dover DMV, so down in Dover, not too far away from the Speedway, but still, centrally located throughout the state. We also know we may be losing some people going back to their primary residence or their states over by that time. So, the education will go out to, how they could look at pharmacies or other options in their states to secure and schedule that second dose. We did expand curative and the number of days that they're vaccinating up in Wilmington right now. They're doing Monday, Tuesday, starting this week. We have expanded them to Monday through Friday. So they're there 5 days a week doing first and second doses, and really just being a foundation to make sure we get to some of the area that has the most high density number of people in the state. They're still in Dover 5 days a week, and we're doing 2 days down in Georgetown on Thursday and Friday. Then on Sunday this week, Dover Downs will be doing a second dose event from events earlier in the month, and actually in March, as the governor said, he's due for his second shot as well. And then past Dover, we'll be, still in the pod business and vaccine business. Again, it's going to be going to a little bit closer to the community, whether it's at school parking lots. We might be doing drive-throughs up in Wilmington and some areas that have shown under vaccinated rates. So it's not going to be the dartboard effect. It's going to be very calculated, where Dr. Tay and her team will look at the vaccination numbers based on percentage vaccinated throughout the state, and we'll use that to kind of drive us in where we have to concentrate on to make sure we're getting the most bang for our buck when we have set up a public event somewhere. So with that, Governor, I'm going to turn it back over to you.
Yeah, so just an incredible effort since mid-December to vaccinate Delawareans. Over 650,000 have received at least one dose. It's nearly 50% of the eligible population. About 30% have been fully vaccinated. The Dover Downs Clinic, as you say, AJ, is really a godsend. Thank God for the Delaware Army and Air National Guard. They've really brought the troops out there. Thank God for the county paramedics, as you mentioned, the Medical Reserve Corps, all the folks that have pitched in, Diane's team at the Division of Public Health, just everybody. DelDOT, the DelDOT folks have been really incredible with traffic control, St. Francis with the hospital, all the various pieces. It just really goes very smoothly. We're going to be hard pressed to replace it. We'll be taking the clinics, smaller clinics, closer to where folks live in Newcastle County, City of Wilmington, Kent County, Dover, down in Sussex County as well. We have had clinics there at the DMVs, which have been successful in the past. But when you think about over 70,000, if you include the FEMA vaccinations, you're closing in on 100,000, well over 10%. Of the vaccines that have been delivered so far. You just really have to thank Dover Downs Speedway for allowing us to use their property, and hope they have a great race as they move into May and have to use the facility for the real purpose of the speedway there. So lots of things moving. We're got our fingers crossed on the restart for the Johnson & Johnson vaccine. I'm excited to get my second dose of Moderna on Sunday at Dover Downs. Went down there about a month ago for the first dose. Really went very smoothly, and would expect the same on Sunday. We do still have to lean into the spread of the virus, stopping the spread of the virus in Delaware by wearing masks when we're in public, going into retail establishments, et cetera, avoiding large gatherings where you can't keep within 6 feet of others. If we can do that, get our way through the spring and into summer, I think we'll really be in a much better shape. We'll have many more people vaccinated. We're already protecting that senior population in a big way, and it's showing up in our numbers. The number of positive cases among those 65 and older that have 70% of which have been fully vaccinated are going down. We are just seeing rises in the kind of young adult crowd, even younger teenagers as well, which is concerning. It just goes to the need for everybody to wear masks when you're in public, to be careful and cautious, and we'll be able to get through it. We are making steady progress on the vaccination side, which is really good news. And we're working with so many partners across our state just to do testing, vaccinations, as well as all the other things to keep people safe. So I know we have a press that have joined us, and we have some pre-submitted questions. Thank you again for joining us this week for the press conference.
All right, first we'll go to Amy Cherry with WDEL. Hi, everyone. Last week when I asked this question, you mentioned that you had an upcoming call with hospitals coming up. And I'm wondering if now you may be able to provide a clearer picture on who's being hospitalized with COVID-19 right now.
Yes, so I think AJ had the most recent conversation with the hospitals. I don't know that we get any specific report on the differences by age. I know earlier on in the spring, late winter, I would say, the report was that folks were coming in a little bit more sick. We were also getting reports that the hospitals had improved their treatment of folks that came in, and were moving people out more quickly than I think in the spring. AJ, I don't know if you have an update from your most recent operational call with the hospitals.
No, I think you summarized it well, sir. The only thing that really came up today is that there's not one demographic or one community that's being pointed out. I'll tell you, I think last year there's times they became almost a contact tracing arm because they were able to identify events and actually worked with the contact tracers to look at families or clusters, but no real smoking starting or catalyst that they've been able to tell us to hone in on anything. And I'm not sure if Dr. Tay has anything to add from the epidemiologist team.
The only thing I'll add is anecdotally, they are telling us that it is a younger population that is being hospitalized as compared to the previous surge.
And the other thing, Amy, if you go back to the slide, and maybe Jess could help us take us back to the slide of geographic areas of concern, which tend to be concentrated in Newcastle County and in Kent County, not as much in Sussex County.
Okay, and other question, I think this one probably will go to Dr. Rattay. I'm wondering if you have any update on breakthrough cases.
I don't have any update on numbers at this point in time. We're continuing to look at that and analyze the data so we can get back to you on that.
Thank you.
Thanks, Amy.
Okay, next we'll go to Brandon Holbeck with the News Journal.
Considering the recent rise in cases and hospitalizations, are there any restrictions or other measures you're considering in addition to asking people to lean into social distancing and mask wearing?
Yeah, I would say not really. I mean, we're hopeful that this is just a little bump in the road, and we're hopeful, not just hoping because we it's the wish being the father of the thought, but we know that we're vaccinating at greater rates. We're protecting the 65 and older population significantly with vaccinations. If you look at the graph for deaths, every fatality is a tragedy for that person and that family, but those numbers are really flattening out. It's a little disturbing that the hospitalization numbers are where they are, ticking up. You can see there on that graph as they've continued to rise. We did hit the bottom there at 99, and our hope was that we would continue south, and we've gone the other way, not in a big way, and the hospitals reflected that as we talked to them on a week-to-week basis, but we really need to see the numbers going in the opposite direction so that we can reduce some of the restrictions. There's not anything that we've looked at that say, hey, if we did this, we could stop the run up in some of these cases, other than to continue to emphasize the need to wear masks in public places where they're required, in retail establishments, to be more careful, particularly at large gatherings. The universities have done a much better job since the issues that we had earlier in the spring with respect to large gatherings and big parties with people without masks and getting together. We don't see as much of that So right now, no, there's not a lot that we're looking at that we think would move the numbers other than, I mean, it's a challenge now to get people to wear a mask and to stick to it after a year of this. And that's what we're trying to do. Other states around us are loosening in a way that maybe that the data doesn't support, but we're trying to stay where we are, get better, and then eliminate or soften some of the restrictions.
And do you have any idea whether from the contact tracing data or any other information you have about where spread has been occurring recently? Is it concentrated in any one place, or do you have any indication of kind of where the spread's happening?
Yeah, we talked about that a little bit this morning on our team, and Carol Rattay and Dr. Rattay mentioned just a minute ago. We really aren't seeing that. You know, if you think about the trajectory from a year ago, we saw it at the beach areas, the beach, you know, social venues and restaurants and bars and et cetera. Then we saw it in the poultry communities and plants. And then we saw it, you know, in the spring, you know, at higher ed and all that. We're just not seeing it there. I mean, it's not in Sussex County as much. Now they've got a higher vaccination rate down there. It's hard to explain whether that's it. It's kind of spread out across Kent County and Newcastle County, kind of more evenly and just a little bit hard. If you look at the numbers themselves, you know, even if you look at 400 being the number, you spread that across a Newcastle and Kent County, and there's still the smalls in each little individual community. The numbers aren't that huge. Dr. Rattay, anything to add to that?
Yeah, I mean, I've been looking closely at our, you know, some of our epidemiology reports, our school reports, our cluster reports, and, you know, most of what we see really is household spread or spread related to social events or activities. No one particular venue sticks out at this point. It's you know, it's a general community spread, but when you know, in looking at the cluster report, for example, there were a number of clusters related to Easter holiday gatherings. So, you know, I think families came together. You know, everyone's hopeful that we're like on the other side of this, but those are the types of gatherings that still, you know, without mask wearing, especially indoors, where unfortunately it's being spread. So it's not all that different than what we had seen before as far as how it's being spread. But yeah, mostly household or mostly social activities.
All right, next we'll go to Tim Mastro from Delaware State News.
Hi, everyone. First question probably is for Dr. Rattay. I just want to know a little bit more about the variants. We always heard a lot about the UK variant, but are those other variants assumed to be more contagious? Has research shown that? And is there a way to project, I think it was 52%, is there a way to project that to assume one specific or most of the variants are probably the most dominant strain right now in Delaware?
Yeah, hi, Tim. If Jess, you're able to go back to that variant slide, the numbers are up on that slide. And yeah, there we go. So by the numbers, the UK variant is the one that we have seen the most with our laboratory testing. The New York virus, and there's two New York viruses, variants we've been keeping track of. This is the B.126, which is the one that is really most prevalent in general. Both of these tend to be more contagious. Not clear about the New York one yet, but the UK one is thought to be slightly more severe than the wild type strain. But these are the predominant strains or variants that we are seeing right now.
All right, and then if you can just clarify the Johnson & Johnson, it's Fridays when there's probably just going to be an announcement. We're probably not waiting on Friday to start distributing again. Did you have any idea of when distribution might be able to start?
Yeah, the report on the White House call was there's a meeting on Friday, and then Friday or Saturday, there's an expectation that some information release will occur from the results of that meeting. No, we don't expect to do anything this weekend. I'll turn it to AJ in a minute, but have some time over the next week if they do open it up again. And it sounded somewhat optimistic on the call this morning. I don't want to jump the gun. They certainly didn't say that. Everybody's hopeful, I can tell you that. But AJ, the thoughts on rolling that out, I know we want to be careful about it.
Yeah, no, so I think Dr. Tay, quickly covered this, but we do have about, 5,000 doses, still left over. And the thought is if the green light is given, it will be utilized next week at our last weekend at Dover National Speedway. We're not going to, if it gets Friday, there's no reason to rush into it to use it this weekend. We know there's going to be questions. There's going to be, concerns people may have. So we want to make sure we have the education, any literature, anything else that we need to absorb and really filter out to the staff. We have time to do that in a proactive way and do it the right way.
Yeah, and the advantage of doing it at Dover Downs is you don't have to reschedule the second at another place, 21 or 28 days later, which could be problematic given Dover Downs has a huge throughput to capacity, and we don't have anything that replicates that. So it would be very advantageous if we could use the Johnson & Johnson there.
All right, next we'll move on to the pre-submitted questions. The first question is from Rodaris Richardson with Telemundo, Delmarva, and WRDE. What efforts are in place to make sure the vaccine is more equitable, and what efforts are being made so that people from the minority community, especially Latinos who work on the front lines, can trust the vaccine and get accurate and correct information?
Yeah, so we have several efforts really targeted at getting an equitable distribution of the vaccine across our state. The first really is the federal program itself. The federal pharmacy program targets pharmacies in areas that have high percentage of Black and brown populations. And we've seen some pretty good numbers and pretty good and improving numbers in terms of the demographics for the vaccines delivered by those pharmacies, particularly some of the Walmarts, which have a very diverse population depending on where they're located, and those numbers have been improving. So you have the federal pharmacy program, which is geared that way. We, as well at the state, have through the Division of Public Health, a number of community-based clinics in partnership with community organizations like First State Community Action, like the Latin American Community Center, and others across our state, like Modern Maturity Center, which has partnered with churches with large minority populations. So a very on-the-ground distribution network, administration of vaccine network in communities. We've partnered with churches and have had clinics there. We have provided, we have outreach teams that work in various communities that give vouchers to some of our larger pods, like the curative sites in Wilmington at the Del Tech campus in Dover and in Georgetown. And then we have a specific outreach program targeted to the Latino, the Haitian poultry worker communities across Sussex County and in Milford, the Milford Purdue plant. The report that we're hearing back from the plants is that the number of doses that they get each week, some of which they administer themselves, some of which are administered by BB Hospital and other partners, the Federally Qualified Health Center, LARED, that they've been getting between 35% and 40% of their associates in the case of one of the poultry companies who want the vaccine. We are seeing some hesitancy there, trying to get the word out among faith leaders and other community leaders that the vaccines are safe and necessary. Those efforts include not just vaccinating the poultry workers, but their family members as well, and doing it in communities. as a way of getting more people to get the shot that's necessary. Our numbers there have improved. Our Latino numbers are really on par with the percentage in the population in terms of those eligible and the elderly population early on. And we're still not where we want to be across the board, but making real effort. Lisa Henry and her team, we have community outreach workers. We've engaged networks. We even had a complimentary comment by one of our biggest critics that's saying that we were doing a better job.
All right, this is the last question. It's from Chris Barish at WHYY. What is the state doing to prepare for the potential unrest or protests after the Chauvin verdict? Do you expect that there will be protests, or would you like to share a message to residents to calm down in advance?
Yeah, well, so we always try to get a message out for folks to be calm and to accept the decision of the judicial system, and to if it's a decision that folks don't like and they want to protest peacefully. We did work hard last spring and summer to develop relationships with the leaders of some of these groups that were demonstrating and protesting, and have followed through on some of the requests that they were making in terms of law enforcement improvements and reform. We have, I know the Secretary of Homeland Security, Safety and Homeland Security, former Superintendent of Delaware State Police, Nathaniel McQueen, has been talking with local law enforcement agencies so that folks are ready to be on the watch for adverse, reaction, a negative reaction. But we're hopeful that a just decision will be made and that we'll not see that here in our state. So I think that was the last question. I want to thank everybody for joining us again and remind folks that we're in the middle of a little bit of a late winter or early spring surge in new positive cases. We're making real progress in vaccinations, and we know that that'll have a very positive impact as we move through this. If we can double that effort by making sure we're careful in wearing a mask and keeping our social distance, avoid large gatherings with other households, and kind of get through the next several weeks, the next couple months, as we increase the number of and percentage of Delawareans who are fully vaccinated. We have about 50% of Delawareans who have received at least one dose. So we're not far from getting half of our population fully vaccinated as we follow through in the next several weeks. The supply of vaccines is going to increase, continues to increase, particularly at pharmacies. So look at your local pharmacy for the availability of an appointment to get a vaccine. If you're younger or anybody who's a little bit hesitant or unsure about getting vaccinated, talk to friends and family members, people that you trust who have been vaccinated, about the experience. It really is important that we get a large percentage of our population with this life-saving vaccine so that we can really go back to a more normal existence. If you like going out to a restaurant and dining, you like having a big party with friends and family, if you like going to a ball game with lots of other fans and doing those kinds of things, then we've got to get to a place where we know it's safe to do all that without putting people at risk. And we're getting there. We're getting there by vaccinating large numbers of Delawareans, and that number is going to increase. We're getting there by the protective measures that we've taken, following the science. We're getting there because so many of you have leaned in to help us get there. And so let's continue on. Let's get to a better place, and let's have some fun this summer. Thanks for joining us.